Focus ultrasound was developed as a treatment for laxity of the skin more than 10 years ago. A relatively low energy beam of high-frequency ultrasound can pass through skin without creating a wound or injury. But if several beams pass through the skin at the same time and are focused on a target beneath the surface, a controlled injury will occur. Some injuries produce a healing response that is accompanied by growth of elastin and collagen fibers, which cause the skin to tighten. Placing many microscopic injuries into a target can cause lax skin to contract, producing a desirable cosmetic effect. The first ultrasonic devices were aimed at targets in the facial layer, below the skin itself, and did an admirable job of tightening the overlaying skin. Unfortunately, their deep penetration also caused considerable pain during treatments and occasionally caused some temporary damage to deep nerves. Because of the potential of nerve damage, certain areas of the face and neck were off limits and could not be treated. Sofwave was approved by the FDA for treating skin laxity of the face in 2021. The technology is similar to the older devices, except that the focal point of the ultrasound pulses is much more superficial, impacting the mid-dermal layer of the skin rather than the deeper structures. The new focal point has reduced the pain of treatment and allowed the entire face to be treated with no danger of nerve damage. The only anesthesia needed is a topical cream placed on the skin 45 to 60 minutes before treatment. Because there is no visible injury to the skin surface, a patient can return to work or resume routine activities immediately. The shrinkage of the skin occurs slowly, reaching a maximum at 2 to 3 months. On average, one treatment is needed, with 90 to 95% of the benefit still visible at 6 months in FDA trials. Occasionally, a second treatment may be needed at 2 months if the response seems slow. The final result should provide improvement in skin laxity for 12 to 18 months.
All right, that was great information, but I'm dying to learn a little bit more. We're here with Carolyn Wampler, who is going to tell us more about Sofwave and what is it? How does it work?
That's correct. Sofwave is a new device that we have, and it is approved to treat lines and wrinkles on the face and the neck, and it is non-invasive, so there's no cutting involved, and it's a one-time treatment.
Oh, really? Well, who's a good candidate for something like that?
Well, Sofwave is an ultrasound device, and it has also has high frequency, so that produces heat in the dermis. Okay. The dermis is a lower layer in the skin that where it houses collagen and elastin. These are what give your skin the youthful appearance. So, Sofwave promotes skin health as well as new collagen and elastin production. And it's not a fast treatment, so you're going to see results 6 to 8 months out from when you actually have the procedure. But people that would be a great candidate for Sofwave are someone that is 22 or above. Okay. They need a little laxity in their skin, a little fine lines, wrinkles. They cannot be pregnant, they can't be breastfeeding, they cannot have cystic acne. They cannot have recent filler in the area being treated, and they also cannot have an electronic device implanted in the area being treated.
Interesting. I'm glad that you know all this information. I'm telling you. Is this something that I can do relatively quickly in the office, or?
Yes, it is a fast procedure. We usually apply topical numbing for about 45 minutes. We rinse that off, and then the procedure itself takes less than an hour.
Oh, nice. So I can come see you and we can talk more about it?
That's right. There's no downtime. You can go exercise, go back to work, anything you need to do after the procedure, but you will continue seeing results for a year or so to come.
Nice. This is why we love Beauty Bash. I've learned so much.